so excited to introduce to you Dr. Erica Lee. Is this better? Can everybody hear me now? Okay. Well, you weren't kidding, Bob, when you said put it directly to your mouth. Dr. Erica Lee is a pediatrician in Washington. She went to medical school at UC Davis and trained in general pediatrics in Los Angeles. She currently teaches medical students from 3 medical schools and interns from 4 residency programs. Certified in pediatric hospital medicine by the American Board of Pediatrics, Dr. Lee is a subspecialist who identifies as a generalist. I'm triggered already. This means she sees a diverse set of pathology and has expertise in formulating relevant clinical questions to ask other subspecialists. In her practice, she constantly integrates new information relevant to the health of children. She is passionate about helping trainees approach clinical problems by mapping out a chain of cause and effect, such that each node in the chain can be examined as a potential opportunity to interrupt pathology. Outside of medicine, she enjoys playing piano, being a mom to 2 beautiful children, and scuba diving. Please give a warm Oklahoma welcome to Dr. Erica Lee.
Load the power. Thank you for that. Thank you for that introduction, Suzanne. Good afternoon, ladies and gentlemen, and others. Let's begin with a movie clip. From a movie, but it is not fiction. This is a real revolutionary song that my parents grew up learning and knowing. There was an earnest attempt in the 1950s in China to abolish the nuclear family and raise children communally through the state. I will show you now some historical real footages of Chairman Mao's meeting with the Red Guards in Beijing. They're shouting, "Long live Chairman Mao." As you can see, the Red Guards are not military or police. They're children of regular citizens. They're waving around the little red book of Chairman Mao's quotations. My children will go to school just like many of your kids and grandkids. Depending on the school district, they have a chance of being exposed to this kind of brainwashing program. As the daughter of folks who have survived the Chinese Cultural Revolution, I'm here to explain how that program works. There are 3 prongs to the identity politics program that is being imported into our schools using vehicles like social emotional learning, culturally responsive teaching, and diversity, equity, and inclusion. Through these curricula, critical race theory and queer theory are being Trojan horsed into our schools. Many of you have met Dr. James Lindsay when he spoke here. In his scholarship, he has demonstrated that these neo-Marxist social theories do not actually care about elevating the voice of the marginalized people. Instead, they're tools to foment a cultural revolution in our country. This is the father of cultural revolutions. His name is Antonio Gramsci. He was an Italian communist and was imprisoned by the Nazis. He postulated there are 5 pillars of society that have to be subverted in order for a cultural revolution to take hold. These are religion, law, media, family, and education. You need the kids, and Chairman Mao knew that. What is the plan with the kids? During the Chinese Cultural Revolution, society was divided into red and black categories. In the black category, which my family belonged to, you have rich farmers, landlords, counter-revolutionaries, bad influencers, that's everybody on Instagram, right-wingers, that's all of you guys, traitors, spies, capitalists, and intellectuals. These are thieves that have stolen the fruits of labor of the proletariat. In the red category, we have poor and lower middle class peasants. How do they differentiate that between the rich farmers? It's arbitrary. Right? Factory workers, revolutionary soldiers, revolutionary leaders, and revolutionary martyrs and their families. These are people that built the country. They're given license by the state to scapegoat the black category people for China's multitude of political, social, and economic problems. They are given license to take collective revenge upon people in the black categories. My mom was in 3rd grade when this way of dividing people started. She told me that overnight, the children of red category people shunned the children of black category people. This quickly escalated to Red Guards conducting terrifying home invasions. Now remember, the Red Guards are not police or military. There are teenagers in your neighborhood who basically formed a gang and is sponsored by the state. So what do they do once they do a home invasion? They ransack the house looking for evidence of counter-revolutionary activity. It could be as simple as like a piece of music written by Bach or a statue of Beethoven. And then they drag the inhabitants of the home into the street to conduct struggle sessions against them. This involved throwing objects at them, yelling abuse, public humiliation, sometimes cutting off half of their hair, like shaving half of their head, putting tinfoil hats on them. And of course, this also sometimes involved physical assault and in some cases, extrajudicial executions. So take a look at the hand gesture of these people conducting a struggle session. Does that look familiar? Where do you think our mostly peaceful protesters got their symbolism? So first part of the program, divide society into red and black categories and scapegoat the black category people for all your country's problems. Does critical race theory scapegoat any group of people and ask for collective punishment against them? Second part of the program is to divide one generation of children from all previous generations. This happened not only under Mao in China, but also under George Lukács in Hungary and Pol Pot of Khmer Rouge in Cambodia. Then the goal is to provide a pathway for some of the black category children to become red, but it will come with a cost. Oh, there is a price. They try to put my mom on this path. Her father was in the black category because he was a Christian minister and he had been killed in a Maoist thought reform prison. So my mom, for being black, was not allowed to wear the red scarf, and she was excluded from the classroom. In order for inclusion to happen, my mom was asked to stand in front of the class and tell the teacher and the 50 or so kids in the classroom that she would denounce her Christian religion, denounce God and church. This means defying her widowed mother and sullying the memory of her father who had been murdered or martyred. My mom refused to do this because she believed that she would be accountable before God, but millions of black category children did denounce their family, and wives and husbands turned against each other. Families were torn apart. In order to become red, you're given extraordinary pressure to give up your soul. You're asked to give up your humanity and betray those closest to you, your friends and family, and your spouse. And when you do that, the party is there to welcome your thought reform. Millions of black category children has done this, and some have brought the Red Guards home to put their parents through the struggle sessions. Your kid comes home from school, hey, mom, I'm pansexual, or demisexual, or paraboy, or non-binary. Maybe you don't react so well. You think that's nonsense. Or maybe you just explain that demisexual is normal behavior. Mom, you don't understand. Ever heard that before from a teenager? Mom, you don't understand? Well, guess who understands? Jeffrey understands. This is Jeffrey Marsh, not Jeffrey Dahmer. And here's what he has to say.
If you need a family, you can come hang out with me. They may not see the real you, but that does not mean that you're not real. I love you very much.
Wait for it.
I'm gonna go cry. With love.
So second part of the program, divide children from all previous generations. Third part of the program is perhaps the most ambitious but difficult to carry out, and that is to have the children carry on a revolutionary spirit so that they want to tear down the existing society and usher in utopia. According to Paulo Freire, the revolution must be perpetual. He was the Brazilian educator who wrote Pedagogy of the Oppressed and Politics of Education. These are seminal texts in the field of education and has helped Marxify American K-12 since the 1980s. So it's been more than 10 decades when they've been working at it. It's been about 30. China was not able to maintain the revolutionary spirit. Later on in the Cultural Revolution, the Communist Party became consumed with infighting, vying for power. The Red Guards were blamed for a lot of the violence and disposed of. Until Chairman Mao died in 1976, then Deng Xiaoping stepped in the 1980s, did the economic reform, opened up the country, and the revolutionary spirit became stabilized through improving the economic status of the population. On the other hand, identity confusion and personality disorders cannot be stabilized through improving the economics of the population. And this is politically useful to queer theorists who want to bring about utopia by abolishing categories and distinctions. So that's one of the ways that queer theory works. And one of the categories that they want to abolish is between adults and children. Queering childhood is a key queer theory project. They want to abolish the concept of childhood innocence. As this incredible paper demonstrates, Dr. James Lindsay has read this in depth on his podcast. Of course, another category that they want to abolish is the difference between men and women. And as you may have already known, the difference between excellence and mediocrity. So there you have it, 3 prongs to this identity politics program. It's a lot of information, and I want to give you a little bit of a mental break. So I'm gonna tell you a funny story. It has to do with the birth of my first child. I went into labor a little bit unexpectedly. I thought it was gonna go on for a couple more weeks. So my husband and I went to a party, or 2 parties. We went to 2 parties, and he drank a couple of beers. And at the end of the night, my water broke. So I had to drive his ass to the hospital. And I was stuck in traffic. After 18 hours of labor, my baby was born. On the 3rd day, I held him in my arms, and I started to worry about his skin color. It was yellow, which made him look extra Chinese, especially with his eyes closed. Turns out he had neonatal jaundice. We went back to the hospital. We got some phototherapy. It's fine. I'm sure he will grow up to be a productive Chinex American, just like his birthing person. So I get asked, why did you want to become a pediatrician? Is it because you love children? And I tell them, well, children are okay, I have some, but I really enjoy dealing with children's diseases. Pediatrics is a intellectually stimulating field, it is true. And we deal with a variety of problems. But there is one condition that my colleagues and I hate to see. We're gonna transition back to talk about a serious subject. And the condition we really all hate to see is child abuse. This is child abuse. I have examined a nauseating number of fractures, wounds, head bleeds in children who have been tortured by adults. And so even though I am a parental rights advocate, I understand that there are a small percentage of parents out there who are really bad parents, or step-parents, adoptive, foster. Some of them are probably worse to their children than Chairman Mao would ever be. And I also know, so there is a place for a legitimate and well-functioning state to step in and remove children from homes in cases of severe neglect or abuse. From my professional experience, I also know that we as a society tend to be very judicious about breaking that bond between parent and child. If a mom is addicted to illicit substances and uses drugs throughout pregnancy, but she gets sober prior to giving birth, and therefore the fetus has already been exposed to substances, but she gets sober before giving birth, and she has a plan to stay sober, she is likely to retain all of her parental rights, including medical decision-making and custodial. If a parent is aware that child abuse is taking place in the home, but is not the one inflicting it and has delayed to take the child to the hospital or alert law enforcement, then she may lose custody, but she still is likely to retain all of her medical decision rights. This means that everything that we put into the child or surgically remove the child, she has a say. We have to get informed consent from her. We rightfully are very careful in normal circumstances before we remove parental rights. Now I want to transition to talk about a particular bizarre form of child abuse. It's called Munchausen's by proxy. Does that sound familiar to anybody? Yeah, that's another way of saying medical child abuse. The perpetrators in these cases are usually the mother, and the goal is to seek sympathetic attention for the caretaker. It is difficult to diagnose Munchausen's by proxy because as healthcare providers, we operate from a position where we can trust the history that the family gives you. Perpetrators of Munchausen's by proxy lie. The symptoms they describe often are very confusing and convoluted, and they seem very desperate. Sometimes they hint at diagnoses that are very rare and unlikely. To make it even more difficult, 30% of the time at least, victims of Munchausen's by proxy also have real medical conditions. When the kids are older and verbal, sometimes they also corroborate the story of the abuser, and they engage in Munchausen syndrome, but not by proxy because they make it up about themselves. And the abuser and victim can be psychologically very enmeshed. It can take up to 2 years to diagnose Munchausen's by proxy, and it is associated with significant morbidity and mortality, including losing time from school, having unnecessary hospitalizations, painful medical procedures, PTSD. Sometimes the medical team also is harmed because they have been unwittingly involved in harming a child. Munchausen's by proxy has been documented in some of the gender clinics. Whistleblower Jamie Reed has stated in her sworn affidavit to the Missouri Attorney General that she has witnessed cases of Munchausen's by proxy in the gender clinic in Washington University of St. Louis. And this is also true at the GIDS clinic, the Gender Identity Development Service at the Tavistock Trust in the UK. When it comes to the care of gender dysphoric pediatric population, I propose that we have a problem of systemic Munchausen's by proxy. The abusers in these cases are not the parents, but activists and ideologues who pose as counselors, social workers, teachers, and doctors. According to Jamie Reed's sworn affidavit to the Attorney General, some of the doctors have actively worked to cut the parent out of the decision-making process in the clinics. What does this kind of abuse look like? That's a double mastectomy scar. For patients like Chloe Cole, scars like these experience chronic pain. That picture was not Chloe's. I found it just on Instagram, easy search. But Chloe's chest probably looks something like that. Her wounds have experienced infection before, and she may be, her nipple graft might be failing. They ooze serosanguinous fluid years after the surgery, and her surgeon doesn't know what to do about it. This is the price of becoming red. This is liberation from the white cis heteronormative patriarchy. It is a macabre horror show cobbled together by an astonishing level of professional hubris. Why do people commit Munchausen's by proxy? It's usually something like this. Look at me. I'm such a victim. I'm so good. I'm taking care of a child who's very complex and vulnerable. Give me attention. Give me sympathy. And these narcissists usually broadcast to people who are very empathetic and agreeable. And those people tend to amplify that message. So this paper over here is from recent psychological literature, which shows that people who frequently signal virtuous victimhood are enriched in the dark triad personalities. So the dark triad is psychopathy, Machiavellianism, and narcissism. Jordan Peterson likes to add a fourth, sadism, but this paper just has experimental data from the three, the triad. So psychopaths have no conscience, they will lie to get what they want. Machiavellians engaged in transactional operations with people, and they will manipulate people to achieve their goals, in this case, often to elevate their social status. Narcissists believe that they're superior to other people. In a care-focused society like ours, a narcissist may just want to appear extra empathetic, and they're supreme in that category. A narcissistic doctor may believe that she has superior clinical judgment. She has access to the new science of gender that other people don't know about. She may also believe that she can take better care and is more needed by vulnerable children compared to their parents. At this point, I want to be clear that not everybody who signals virtuous victimhood is malevolent. There are real victims and real saints out there, and we do deserve to pay them attention. The problem happens when bad actors impersonate them, so we have to be discerning. Also, I want to be clear that there is a small percentage of the population, a very small percentage, which does have gender identity disorder, which persists into adulthood. I have met trans adults who have a stable identity and they're not political activists, and I've enjoyed their company. Actually, some of these adults are advocating for a much more judicious approach to transitioning children. Remember that 30% of the time in Munchausen's by proxy perpetuated by individuals, the child has a real medical condition? So just because you found a medical condition, if the family behaves really weird, you may not have necessarily excluded Munchausen's by proxy. So extending that to the systemic form of Munchausen by proxy, just because there exists real trans adults who are stable and high functioning, it does not mean that this condition is not being overtreated and overdiagnosed in children. I would like to give an analogy. There's a condition called psychogenic pseudoseizures. It is a conversion disorder triggered by having had traumatic experiences. It's a manifestation of PTSD. In psychogenic pseudoseizures, the patients really do convulse, just like they have seizures, but we prove by their electroencephalogram, the brainwave exam, that they do not have seizures. Or in some cases, they also have epilepsy, but then not all of their convulsions are seizures. We do not treat psychogenic pseudoseizures with anti-epileptic medication. We have to treat it with intensive psychotherapy and rehabilitation. Think about how absurd it would be for seizure patients and the Epilepsy Foundation to get together, create an identity politics program stating that if we diagnose some people with psychogenic pseudoseizures, it erases the personhood of seizure patients. Similarly, just because there are transgender adults who appear to have truly benefited from medical transitioning, it does not mean that that treatment is appropriate for all children that have that symptom. You have to look at the cause of what is causing their gender dysphoria. Finally, I would like to be clear that there are some healthcare professionals who are truly judicious and conscientious when it comes to the care for gender dysphoric children. Some of them work at gender clinics and served as whistleblowers. Some of them still work there and perhaps want to have a voice of speaking up, but they do get bullied by ideologues. So it's definitely not the case that everybody who works with this gender dysphoric population is an ideologue. A lot of them are more on the liberal, progressive side of the political spectrum, and we have to make it comfortable for them to come forward and speak up and tell us their concerns. Ultimately, the onus is on our medical institutions to safeguard children against medical child abuse. Unfortunately, multiple medical societies have failed in that regard. The leadership of the American Academy of Pediatrics has refused to allow Resolution 27 to come to a vote by its own members. Resolution 27 calls for a systematic review of the scientific evidence regarding transgender care, and we have not been able to vote on that resolution. So as a result, we do not have true practice guidelines in this entire field of medicine. It's the Wild West. We do not have diagnostic criteria which will help us predict which teenagers will go on to benefit from puberty blockers, cross-sex hormones, and surgery. We do know that when parents are cut out of the decision-making process, bad things happen. You guys may have heard of SAGE from Virginia. You can read about SAGE's bill. Also, several detransitioners have come forward and stated on public records that they and their parents have never been properly counseled on the risks associated with medical transitioning. And these include sterilization, loss of sexual function, liver failure, recurrent surgical infections, failure of surgical tissue graft, bone density loss, incontinence, brain damage, persistent suicidal ideation, and chronic pain. Instead of properly counseling the parents and the teenagers, these families were told that if they didn't go along with medical transitioning, the kids would kill themselves, which is not true. Instead of being given the opportunity to give informed consent, these families have been emotionally blackmailed. Ladies and gentlemen, we have a crisis of systemic medical child abuse. To correct the errors of institutions, of schools and clinics, we must reestablish the primacy of individual rights in accordance with the ideal of a classically liberal society enshrined in the Constitution. This means codifying parental rights in education and in medical decision-making. When children face invasive educational, psychological, and medical interventions, both custodial parents and/or all the guardians involved have to be guaranteed the full right to informed consent according to an updated version of the Nuremberg Code. I have taken you on a whirlwind tour through the Chinese Cultural Revolution to our own. I have talked about how identity politics has been injected into our schools. Then I explored how narcissists use other people's children to virtue signal for their own goals. I explored how psychology and ideology intertwine to foment our crisis of systemic medical child abuse. We live in dark times, but because of the love that parents have for their children and the sacrifice that we're willing to make on their behalf, we have hope. We are parents. Let's get to work. Daybreak is coming.